area of deprivation, and it's one of the most deprived areas in the city, with a lot of chronic disease and a lot of health problems. So a service like this is actually targeting those sort of communities. So that's why we became involved in the programme, to try and help our patients to take a bit more control over their lives and to improve their health and their general well-being.
I think health trainers generally come from the person's own community. Okay, so they have the advantage of being recognisable. They also have the advantage of being able to speak the same language, and they are not health professionals, and in some ways that's an advantage because people will go to them with a different expectation. Okay, they're not going expecting medication or medicines or any other kind of therapy. They're going literally because they want someone to get alongside them and help them manage that problem themselves.
For example, I live in Darnall area, and to have an understanding of some of the issues and some of the activities that are available, and to really sell it to the client and get involved in that. And even to see them on the street and to say hello and have a chat with them about, you know, the service that they've received, and for them to really come hear about what we do, learn about what we do, make changes, and also to go out and tell it to their friends and families.
We're more of a buddy and a friend next door, so we're able just to offer them support that's realistic in that they know that we're just like them in some ways. So it's just common sense a lot of the time, but when it's coming from someone else's mouth, you listen to it a bit more.
So I think this is very, very important, and it's something I think that we've missed out on before. We've kind of made generic health education films, generic messages, and they really don't have that local impact.
It's not just knowing that people need to eat healthy, stop smoking, lose weight, do more exercise. It's putting that into context of the lives that people lead, the facilities that they have locally, the kind of pressures that they're under in their day-to-day lives. And I think it's that understanding that health trainers bring that makes a difference.
One of the advantages this service has, especially to GPs, is that GPs don't have much time. They have just 10 minutes to see someone, and actually people want to be able to learn to manage their conditions themselves, and that often takes a lot longer than a GP has to offer. But GPs obviously benefit from people managing much better themselves, and the health service as a whole benefits. So I think GPs could see the value of it purely by actually having someone who can spend that extra time, which is valuable.
Because they can sit down with patients and go through things in a bit more detail and a bit more leisurely pace, and give a bit more time and concentration to what the patient's needs are, and then move that forwards, either perhaps providing the needs or signposting them to somebody else.
We also use local community resources such as children's centres, doctor surgeries, community centres, so that we can be at local level for local people.
This is a drop-in centre. They can come, they can talk with us. When we have appointment, they can share information with us. It's a friendly and safe environment. And I think it's quality time spent with them and reassuring them that, you know, whatever goal they want to achieve, we're there to support them, to help them achieve their goals.
What we talk about is prevention through encouragement, motivation, giving them resources, telling them what's happening in the area, in their local area, say a health walk, which I had a client who for 50 years lived in the same area, never been to walk, never been to park even. So when he started, he was a regular on the walk. This is not we are writing down any prescription for them, or only prescription is the motivation which we are giving them and saying there is something you can go out, try. Once they try, most of them enjoy.
I was speaking to a GP recently, and she's got a lot of people with long-term conditions, particularly a lot of people with diabetes, and she sees them every few weeks and, you know, does her best with medical treatment and care. But all she was seeing was that they were getting worse. However, since we've had the Health Trainers, Health Champions programme, the transformation is incredible. And she said it's brought light into her life as well, because you can see a big difference that people have gone back to work. They've lost a lot of weight, they've come off their medication. And also they feel like they're in control of it and a part of the decision making.
It's about people being able to have a rounded view of their own, of health and well-being for themselves, their family and their communities, and from there work out for themselves These are the priorities that actually I think I should be addressing, or I can.
You know, you don't just suddenly wake up one day and your confidence is great. It's little steps as you feel that you've actually made a difference, something that you've done, you've put some effort into, has made a difference. It makes you much more willing. It opens your mind to other possibilities as well. But it also has a knock-on effect on your own sense of well-being, your own self-esteem, and your feeling that you are actually able to make improvements in the way you feel and the way you live your life.
I think the more gentle and more encouraging approach that health trainers can give, because of the time that they can give, I think is really, really fruitful.
In this initiative, we have community nurses working alongside health trainers, working along health champions, working alongside GPs and the whole of the practice team. And I think, apart from the benefit that patients will feel, I think as individuals within those teams, we will feel a mutual support for each other, which I think is really important.
I think, you know, a message to GPs and other clinicians to wake up a little bit and be aware that these things are out there and use them.